Well, good afternoon and welcome to our Coping with COVID webinar series. I'm Dr. Wendy Smeltzer, National Medical Director of Wello, our telemedicine program, and for Live, our clinic in Calgary. And this week, as many of you may know, is Canadian Mental Health Week. We've been focusing on mental health issues that have arisen through these past couple of months of the COVID pandemic. And one topic that repeatedly seems to come up has been in the course of our sections, concern about sleep. People are finding that through this pandemic, they're having lots of sleep issues, insomnia, disturbed sleep patterns, vivid dreams, and the inability to feel rested. So I'm really pleased today that we have psychologist Karoline Sandhurst with us, and she's going to dive deep into this topic and share her knowledge and advice. Karoline is a regular psychologist with over 20 years of counseling experience in the Calgary area. She has a special interest in sleep and sleep disorders, and she loves teaching people how to sleep well as a way to improve their mental health and their vitality. Over the past 5 years, Karoline has been teaching physicians, nurses, and other health professionals how to use something called cognitive behavior therapy for insomnia strategies, and that works very effectively with their patients. In her private practice, Karoline also teaches people how to manage stress, deal with burnout, deal with anxiety, and live with meaning and purpose by doing more of what matters. And all of these things are so relevant for these COVID times. So thanks for being with us today, Karoline. I'll turn it over to you now.
Do I have to start it? Thanks so much, Wendy, for that introduction. I'm so excited to be invited to come and speak with you during your mental health series. Sleep is one of my favorite things to talk about, and I'm hoping that in this talk today, we're going to focus on some of the root causes of insomnia and sleep problems so that people can get a better sense of why insomnia happens in a more targeted way and what they can do to resolve their own insomnia concerns. I'm hoping that by the end of our talk, people are going to be able to kind of have a plan that they'll be able to start enacting even tonight to start making their sleep better and more restored. So we're going to talk a little bit about why insomnia develops and why it might be worse now during COVID. I'm going to talk about strategies to prevent and correct insomnia, and also for people that have struggled with insomnia on and off their lifespan, how not to make it worse during this time. So I think the first thing that I want to say is that sleep and mental health go together, and I think all of us know that when sleep is better, mood is better, and when mood is better, sleep is better. There's an interactive pattern between those two things. One thing that we know that's really important is that insomnia is a significant risk factor for depression. What I mean by that is that it's an independent risk factor. So if we take a bunch of people that have no depressive symptoms and we deprive them of sleep and they sleep poorly for 2 weeks, by the end of the 2 weeks, they will start to show signs of clinical depression. So for people that have had a history of depression, it's really important to target their sleep and to work hard on addressing concerns that are affecting their sleep to prevent a relapse of depressive mood in the future. We also know that people that have experienced trauma have an increased risk of PTSD when their insomnia isn't treated. So just by helping a person sleep better, we can decrease the likelihood that they're going to experience PTSD symptoms. I think we all know that poor sleep makes anxiety symptoms worse. And the reason that that happens is that our brain and our body give us a little boost of adrenaline, a little kick the next day when we've had a really bad night. And so for people that experience anxiety, they may notice that their anxious symptoms are worsened when they have a bad night. And like I mentioned, for people that have experienced depression, treating insomnia improves their mood symptoms, but it also reduces the likelihood of relapse. So what I'm going to be talking to you about today is what's called cognitive behavior therapy for insomnia, or CBTI. This is a very well-researched model of insomnia treatment, and it's a treatment that helps people learn to fall asleep and stay asleep without or alongside medications. We know that CBTI improves sleep quality by changing sleep habits and creating more adaptive thinking about sleep. You'll notice that I didn't say that sleep quantity increases. And so our goal when we're using cognitive behavior therapy for insomnia is not to turn a person that normally sleeps for 6 hours into an 8-hour sleeper. It's to create what we call sleep efficiency. Sleep efficiency means that about 85 to 90% of the time that you're in bed, you're asleep. It's to maximize the amount of sleep that a person is getting, the quality of that, but not necessarily to turn everyone into 8-hour sleepers, because as we're going to discuss, there's no cookie cutter approach to the amount of sleep that people get. CBTI is well known to be as effective as medication for treating insomnia, but in some ways it's better because new information and skills are learned for managing sleep, and the gains that are made are long-term, and they can be returned to life later in life when and if problems emerge again. People develop the skills that they know how to treat their own sleep problems. So obviously, things are much different now than they would be for people. And I think one of the main reasons why being home, self-isolating is causing more sleep problems is that every day of the week is now Sunday. People's routines and regular way of life has been really significantly disrupted. And our bodies don't like that. Our bodies like to have a routine of day and night and Monday to Friday and the weekends. And all of that has been thrown out the window. And now, people don't know what day it is or which way up is. And so that's also messing with our sleep systems. But I'm here to tell you that even for people with very challenging sleep problems that have had them for a long time, CBTI can start to improve a person's restorativeness and quality of sleep quite a lot. In as little as 1 to 2 weeks, people start to see a lot of change. And even for people with long-term problems, by the end of 4 weeks, they are often significantly better. So just a little bit of definition. So when I'm talking about insomnia here, I'm talking about difficulty initiating or maintaining sleep. So difficulty falling asleep or difficulty staying asleep. And to meet the definition of insomnia, we would say that would have to be happening 3 times a week for at least 3 months. And for people that have had that experience for 6 months or longer, we would call that chronic insomnia. And so insomnia is a very common part of people's experience. Usually about 10% of people have insomnia at any one time. I'm going to make a little bit of a disclaimer about the strategies that we're going to talk about today, that if you have some other factors that influence your sleep, things are going to be a little bit more complicated for you. So examples of that could be if you're a shift worker, if you have pain at night or a medical condition that impacts your sleep, if you have obstructive sleep apnea or you use a CPAP, or you have another kind of sleep disorder like sleepwalking or sleep aggression or restless leg syndrome. All the strategies that I'm going to talk about are applicable to those situations. However, I would want you to consult with your family physician because ideally we want to have those conditions treated as well as possible before we move on to behavioral strategies. So that's my disclaimer. So first thing we're going to talk about is how much sleep is a normal amount of sleep. And what this chart that you're looking at is showing you is the range of sleep that would be acceptable. So if we look at an adult, we would see that 7 to 9 hours is generally recommended, but 6 to 10 hours may also be appropriate. And so there's a wide range of what amount of sleep that people need that's largely determined by how restored they feel. And so there is a lot of variability from person to person. And why this is really important is that sometimes expectation about how much sleep they should be getting, they will try and force their body to get it. They will spend more time in bed. So maybe they've heard that 8 hours of sleep is a good amount of sleep. And so they'll spend at least 8 hours in bed, but their body really only produces 6.5 hours or 7 hours of sleep. And so they're always thinking, well, I need to spend more time to get that extra hour because that's what I've been told is a good sleep. So that might be the first time you've heard someone use that phrase, how much sleep the body produces. And what I'm going to be talking with you about is that our bodies work exactly like that. Our bodies have a substance in all of our cells that builds our deep sleep drive that determines how much sleep we produce. And we're doing really well with our sleep when we match our time in bed to the amount of sleep our body produces, rather than try and chase sleep or get sleep. When we chase sleep or get sleep, sometimes we're laying the groundwork or the foundation for insomnia. So you'll also notice that as people get older, sometimes the need for sleep is a little bit less, not all the time, but the restorativeness of sleep can be affected as we age, and people, again, can fall into a vicious cycle of spending a lot of time trying to get sleep when that's not how much their body is going to produce. So let's talk about how insomnia develops. Basically, what's happening in insomnia is that you have a bad night, which is the case for everyone. Something could disrupt your sleep. Maybe it's feeding a baby, or you have a new puppy, or there's some noise in the neighborhood and something wakes you up or disrupts your sleep over the course of the night. So let's take a moment and think about what you do the next day, the day after a bad night's sleep. So maybe you hit the snooze and try to catch a few more Z's. Maybe you miss breakfast or go off your typical meal time. Perhaps you drink an extra cup of coffee. You might feel fatigued, so you don't get as much done as you normally would. You might miss your exercise routine, lay on the couch, or nap. And it's the behaviors that you engage in the day after a bad night that determine whether insomnia is going to develop and whether a vicious cycle is going to start. So here we are looking at the vicious cycle of insomnia. So of course, everyone that's had a bad night is going to feel fatigued, lethargic, and have low energy. This of course can be really amplified if you struggle with depression or chronic pain or any other medical condition that impacts your energy. And then how we cope with that fatigue or low energy is often by reducing our activity and spending more time in bed to try to catch sleep. But as soon as we do that, our sleep system is negatively impacted. And so when I say sleep system, what I mean by that is the combination of our body clock and our sleep driver system. And that's what I'm going to talk about in detail here in the next few minutes. So as soon as we impact our sleep system, insomnia develops and we begin a vicious cycle of fatigue, coping with reduced activities, and having our sleep system get more and more negatively impacted. We're going to talk about in this presentation how to break that vicious cycle and what some of the strategies are that you can use to get your sleep system back on track. One of the things I like about working with insomnia is that it only has 3 causes. And as a psychologist, most of the problems that I work with have multiple causes and they have multiple solutions and things are not as clear. But when it comes to insomnia, we have 3 causes, and we know that the strategies that we use to address these causes work very, very well. What determines the outcome is largely how much effort and how determined you are to kind of follow the rules. I'm going to give you a number of sleep rules. And what I like to tell my patients is that I'm going to send you to sleep boot camp for 2 to 4 weeks. And for 2 to 4 weeks, you're going to work really, really hard on these rules and buy the book. And at the end of that time, when your sleep is much more restorative and you're feeling well, then you can start to relax those rules just a little bit. So the rules have to do with each of these causes of insomnia. So our stressor, whatever that is, that gave us a bad night, creates a short-term sleep disruption. Then we do something to compensate with the fatigue. And depending on which of those things that we've done to cope, we might have messed with our body clock, our circadian system. We might have messed with the sleep driver system, or perhaps now our brain and body are buzzing. A lot of questions came in ahead of this talk about sleep medication. So I hope to be able to touch on some of those things. And when we're talking about sleep medications, perhaps a medication that's prescribed by a physician or something over the counter to kind of try and knock you out, it's addressing the 3rd cause, the brain and the body is buzzing. So a sleep medication like Zopiclone is trying to help sort of down-regulate you and put you to sleep. And it does work for the 3rd cause, but it does not help you for the other 2 causes. And those sleep medications are designed to be used for short periods of time to help you get back on track. And what happens for some people is that they aren't sure how to decrease their use of the medication because they don't know how to get their sleep back on track. So I hope that I can give you some strategies and ideas around that. The other medication that we had questions about was melatonin, and that relates directly to the body clock of their circadian system. So as I talk about each of these systems and the strategies, I'll make sure I come back and talk about melatonin. Now, I know what you're thinking when you see this. If you've had insomnia, you're looking at these 3 causes and you're saying to me, Karoline, my problem is number 3. My problem is that I have a racing thoughts. At night, my mind is totally busy all of the time. I wake up, my mind is filled. Sometimes it's about something stressful. Sometimes it's about something random like my grocery list. And if I could just shut my busy thoughts off, I'd be able to fall back asleep. And I'm going to tell you maybe something that runs a little counterintuitive to that, which is that a busy mind is not a cause usually of insomnia. It's actually the effect of laying in bed when your body and mind aren't ready for sleep. You might think that you need to shut your brain down. However, the problem usually lies within your sleep system, those 2 things, those first 2 causes. And if your sleep system is a little out of whack and you are laying in bed and it is dark and quiet, it is very boring. And you are going to think about anything and everything because your mind and body are not ready for sleep yet. The other thing is that controlling thoughts is one of the most difficult things that you can do. It's very, very effortful. And the more that we try to control our thoughts, the harder it gets. So we're going to try and use strategies to regulate the sleep system. And what I know as a psychologist that works with sleep a lot is when we correct the first 2 causes, the circadian rhythm and the sleep driver system, the 3rd cause, the buzzing mind, takes care of itself. In fact, maybe you've had the experience of being so tired that you cannot think. And the usefulness of that is that you don't have to exert a lot of effort or do magical things to try and force your body to sleep. So here's what you will not need. You will not need to buy expensive weighted blankets or to learn how to meditate. You won't have to buy a new bed or do breathing exercises, use a white noise machine, mental distraction techniques, try essential oils, sleep stories, or learn how to do self-hypnosis. Although lots of those strategies are very useful relaxation strategies, when it comes to CBTI, we find that when we correct the behaviors around sleep, you don't have to exert so much effort and your body can fall into a natural sleep. So the golden rule of CBTI is stop trying so hard. Sleep is a natural thing. It's just like appetite. So if I were to say to you, I want you to induce hunger in your body right now. It's lunchtime, you should be hungry. I mean, what would you do to induce hunger? Maybe you would do something to burn up some energy, or maybe you would just wait until you got hungry. Even if I said to you, it's lunchtime, you have to eat lunch. You're supposed to eat. That doesn't necessarily mean that your body is primed to eat, and sleep is a lot like that. The more that we try to force it, the more elusive it becomes. We can force ourselves to eat, but we can't force sleep. In fact, the more we try to force it, the more rituals and behaviors and strategies we try, sometimes the more anxious that we become about sleep, and the nervous system just gets more activated and more arousal is created. And obviously, arousal and sleep are the exact opposite of each other. So one of the things that we want to do is begin to remove pressure to sleep completely. So let's talk about what's happening for a good sleeper versus a person with insomnia. And I put good sleeper in quotes because even people that have good sleep, there are periods of waking. That is a normal part of the sleep cycle. So if we look at our good sleeper chart at the top, maybe they went to bed around 10:30. The time isn't too important. They spent a little bit of time awake in bed. So that's that lighter green color. And then you'll see that over the course of the night in the dark blue when they were sleeping, they woke up multiple times. It's really important to notice because waking at night is a normal part of sleep. It happens to everyone. Our sleep goes through cycles. So we go stage 1, stage 2, stage 3, REM, and then we wake. And we go through this cycle about every 90 to 120 minutes. And so I like to tell my patients, it's a good thing you woke up in the middle of the night, because if you didn't wake up, it means that you're dead. Waking at night is normal. Now, for a good sleeper, they will tend to not even be aware that they ever woke up. They will maybe roll over, change their position, and fall back asleep within a couple of minutes. But a person that's been struggling with sleep may become very aware of the fact that they are waking because they already know that sleep is a problem. They may glance at the clock and say, oh no, I'm awake again. It's 1:30, it's 4 a.m., it's 5:30. And so if you are waking sort of about every 90 to 120 minutes, I would say, well, that's good and that's normal. Some people have the experience of waking up the exact same time every night. They'll say to me, I woke up at 3:23 again. Why is that happening every single night? And that's actually a sign that you're in a good rhythmic sleep cycle, and you are waking and you're just looking at the clock and noticing. Probably your sleep habits are very normal. But what happens in a person with insomnia is that waking is distressing, and they pay a lot of attention. They may be very concerned about it, and they may toss and turn and spend a lot of time trying to fall back asleep. You'll also see that our person with insomnia went to bed a lot earlier than our good sleeper, and that's because they were so fatigued. So they were trying to get sleep at an earlier time. And our person with insomnia woke up at about the same time, but stayed in bed longer because they had a bad night. And so when they had a bad night, their sleep was restless, and so they tried to get more. But the quality of sleep that you usually get early in the morning is not that great. So what we see is that our good sleeper maybe spent 8 hours in bed, but our person with insomnia spent about 11 hours in bed. And what happens when you spend more time in bed is that the amount of sleep that your body produces gets diluted over that time. It's sort of like, it's weaker. The sleep drive is weaker. And so you may find that you're not restored. And I think we all know that like 6 hours of consolidated sleep feels a lot different than 8 or 9 hours of broken sleep. And what we're trying to do in CBTI is generate consolidated sleep. So let's talk about how to do that and the 3 parts of the sleep system and strategies for each of those areas. The first one that we're going to talk about is the body clock, the circadian system. This is probably something that you've heard before. Circadian system is like, as human beings, we are designed to be, for the most part, awake in the day and asleep at night. And our circadian system controls via chemical signals in our body when we feel sleepy and when we start to feel alert in the morning. And our chemical signals have a rhythm to them. They rise in the day and they fall off in the evening. And when they fall off, there's an optimal time for sleep. That circadian system is really impacted negatively by a lot of variability in the schedule. So here's an example of the circadian rhythm of alertness that's sort of typical. It's a 24-hour clock. So you can see the red line shows that, 1, 2, 3, 4 a.m., there's very little alertness. And then as the day goes on, the alertness drives up and there's a bump down in the afternoon. That bump down happens shortly after lunch. It might be hitting some of you soon, depending on what time zone you're in. And you might start to feel like you could sort of nod off, and you might think to yourself, what did I eat for lunch? But actually it has nothing to do with what you ate or how many carbs you ate or whether you ate a giant burger for lunch. There is a natural dip in our circadian rhythm of alertness in the afternoon, and then it rises again and falls off. Now, if you're a morning person, your circadian rhythm of alertness is shifted a little bit back. So you may find that your alertness starts to rise a little bit earlier and falls off earlier. And if you're a night person, the rhythm of alertness increases at a little bit later time of the morning. The closer we are to our body's natural rhythm, the better it feels for us. But sometimes we get in the way of our body's rhythm and we kind of mess with it. For example, let's say there's something good on Netflix, like Tiger King, and you stay up late binge watching it until 3 or 4 in the morning because it's so good and you're riveted. What's then going to happen is you're going to sleep in later, and then the following evening, you're probably going to want to go to bed later. And the following day, that may create a bit of a cycle. And so that shift in the circadian rhythm by an hour or 2 is enough to create sort of like a jet lag effect. So you really only have to shift your circadian rhythm by about 2 hours. This happens a lot in, I guess I want to say, normal life in our Monday to Friday schedule, that Friday night we stay up late, we sleep in on Saturday. Saturday night, we sleep up late, we stay up late, we sleep in on Sunday. And by Sunday night, we cannot fall asleep. And the reason for that is that it's like we flew to New York on Friday night and flew back on Sunday evening. And now our body is out of sync with the wall clock. So the more that we vary our times, the more our body has a difficult time adjusting. Traveling across time zones is not that good for our body. One of the ways that we can kind of help ourselves like with this, especially during COVID, which is a little bit of an advantageous situation, is that we can use this time, if you're at home, to get a little more in sync with your body's natural rhythm, depending on whether you're an early bird or a night owl. So if you're an early bird and you want to do more of your productive activity earlier in the day, you can do that. And if you're a night owl, you might want to be doing more of your sort of productive activity later in the day. And this is not an advantage that we already have. A lot of night owls are prone to insomnia because night owls often have to be on an early bird schedule. So they're more of a night person, but they have a regular 9-to-5 job and have to be up early. And so they can be more prone to insomnia because they're always trying to get on somebody else's schedule, even though their bodies really want to stay up late. So it's worthwhile sort of noticing what your sort of circadian rhythm type is and trying to get into sync with that. So key tips for the body clock, what I'd like you to do is to try to accommodate your owl and lark as best you can, to set a regular time that works for you, and I want you to adhere to it as much as possible to try to avoid jet lag. And a thing that helps with circadian rhythm is getting early morning light. So if you can step outside early in the morning, you know, you may not be very alert. As long as you're upright and in a sunny spot, basically what you're doing is you're priming the circadian pump for your sleep the following night. And we're going to talk about, in our next section, a little more about going to bed when your body signals sleepiness. Not by the clock, not when you think you should go to bed, but when your body actually starts to feel sleepy. So a little note on melatonin here. So melatonin, as you're aware, is a naturally occurring substance in the body. And melatonin is indicated for jet lag. In other words, what I mean by that is that it helps with jet lag. And the reason that it does is because it's advancing the circadian cycle to help a person fall asleep. So why does it not work for everyone with insomnia? Well, you'll remember that there are 3 causes to insomnia. So when you take melatonin, maybe it helps a little bit with the circadian system, but it does not help with the other 2 causes. So for the vast majority of people that have insomnia that is not legitimately caused by travel or shift work, melatonin usually does not help that much. It will give you like a very small improvement, but usually not enough to give you good restorative sleep. Usually we need to do a combination of these 3 things. So first part is to regulate your rhythm. Now let's talk about the sleep drive system. This is usually the part that is something that most people are not aware of and have never heard before, that our body has a natural way of producing a chemical called adenosine. And adenosine is something that builds up in our cells over the course of the day, and it increases our drive for deep sleep. And our sleep drive is what's going to determine how much sleep we have and how deep our sleep is. The lower that our adenosine is, the lower our drive for sleep is. And what that's going to produce is a very sort of low quality, superficial sleep where you wake frequently. So one of the things we're going to talk about in this section, which we got a lot of questions about, is about middle waking. And middle waking is often related to problems with the sleep drive system. A really cool thing about having an active sleep drive system is that the stronger your sleep drive is, it actually inhibits, we would say as psychologists, we would say it inhibits cognition. And what I mean by that is you get so tired that basically you can't think. So you don't have to worry very much about your racing thoughts. Your body goes to deep sleep right away, and you don't have to do anything to try to relax it. So I think the best way to demonstrate what adenosine is with a little demonstration. Okay, so I'm wondering if this is going to be one of these situations that goes horribly wrong on the internet. I'm hoping not. This is a demonstration that I often use to show people what adenosine is and the impact that it has throughout the day. So this is going to be called Marge versus Homer. So this red balloon, it's going to I'm going to use it to sort of demonstrate how adenosine builds throughout the day. So let's think about Marge's routine throughout the day. So Marge wakes up in the morning with the sun hitting her face. Oh, we've already got a little adenosine in the system. She hits the shower. She wakes her kids and gets breakfast going. She lets the dog out into the yard and stands in the morning sun. She might get a few things done on her to-do list in the morning that she's been meaning to do. Has a bite to eat for lunch. She chats with a friend in the driveway in the afternoon. She takes the dog for a walk before dinner. She has dinner with her family and then spends the evening relaxing. All of those activities are activities that are building adenosine in the body. So when Marge goes to bed, the adenosine is going to deflate just like this balloon, right? And so that shows that her brain and body are going to go to deep sleep quickly, and she's going to experience a deep and restorative sleep. Very satisfying. So let's talk about Homer. So when Marge gets up, Homer pulls the blind closed and he lays in bed dozing, hoping to get a little more sleep. And then a couple hours later, he gets his feet on the floor and he heads to the kitchen where he grabs some coffee and hits the couch. So what I want to tell you about coffee is that it's an adenosine blocker. So any adenosine that would be produced by activity is now blocked by the impact of caffeine. So even for people that would say caffeine doesn't really affect me, I don't really feel jittery, what you need to be aware of is that it's blocking your sleep drive for the following night. So back to Homer. It's now 11 in the morning. He eats a few leftovers out of the fridge. And he decides to get up and let the dog out. But now he's back on the couch. In fact, he would like a nap now. He feels sort of lethargic. So he takes a nap. And so as soon as you take a nap, what happens is some of that adenosine is now released. Once he wakes from the nap, he has to get up and yell at the kids out in the neighborhood for making too much noise. So that was good that he got up. And maybe he decides to eat dinner with his family together. And then spends the night waiting for the opportunity to go back to bed. And when he does, this is how much sleep he's going to produce. So adenosine is built through our activities of the day. And as it builds up, it's determining the quantity and the quality of the sleep that you're going to have the following night. For that reason, we would really say that insomnia is like a 24-hour problem. And when the adenosine runs out, you will wake. And the important thing to know about this is that if adenosine has run out and you wake, no amount of trying harder, no amount of sort of relaxation strategies or lavender or sleep stories or any of the other strategies that we like to use to relax will help put adenosine back in the system, because your body has produced all the sleep that it is going to. So it's a really important concept to get your head around. And I think what's making things much more difficult for people during COVID is this, I like to call it the sweatpants effect, which is that we're all sitting around in our sweatpants. We have much lower activity than normal. We maybe don't have to commute. We don't have to get up and out into the sunlight as much because we're not forced to. Our bodies are going to be producing a lot less sleep. The other thing is that our habits are that we may be like wearing sweatpants all day long, and we're signaling to our body that we're kind of in lazy Sunday mode. And these two things conspire to basically result in much poorer depth and quantity of sleep than we would like to have. And that vicious cycle starts to get activated. So what I want you to take away from this is that your activities during the day have a much stronger impact on how well you'll sleep than what you do in the last hour or two before bed. If you want to improve middle waking especially, I want you to be thinking about how active you are in the day. The more lethargic you are, the lower sleep drive you're going to have and the less sleep that you're going to produce. One of the things that can happen with us too is that we confuse fatigue with sleepiness, and people are dealing with a tremendous amount of stress and anxiety right now. Feeling stressed and feeling anxious definitely produces fatigue. It requires a tremendous amount of mental energy to be sort of mentally problem solving all day long. And when we are fatigued, we may feel that we want to sleep to feel restored again. But when you're given the opportunity to sleep and you have fatigue, you usually can't. Most people that I know that have insomnia, I'll say to them, do you ever nap? And they said, yeah, I napped once in 1996. It was fantastic. They lay on the couch with a great desire to sleep and feel restored, but they don't. And that's because confusing fatigue and sleepiness is very common. When you're fatigued, you feel unmotivated, tired, sluggish. You may have a low mood, and it may be hard to get yourself moving, but that's not the same as struggling to stay awake, falling asleep even when you're not supposed to, such as while watching a movie, and sleepiness that's a potential safety issue, like it is for sleep apnea. So let's talk about a few key tips for increasing sleep drive. First thing, I want you to not hit the snooze or linger in bed, because the quality of sleep that you're going to get at that time is not that great. Adenosine starts when our feet hit the floor, so try and get yourself vertical. Beware of napping, because if you nap, it's going to deplete your adenosine for the following night. Remember that caffeine is an adenosine blocker. So if you are struggling with sleep right now, you might reduce your caffeine use until your sleep is back on track again. See if you can get out of your sweatpants and be as active as you can during the day to avoid the sweatpant effect. Keep in mind that when adenosine runs out, a person wakes. So really trying harder at that point to fall back asleep is not always going to work. Usually what we'll encourage you to do, we're going to talk about that a little bit more, is to just get up and do something else rather than tossing and turning and trying really hard to fall back asleep. Your body may not be producing much more sleep. To correct this, this issue, we use a strategy called sleep restriction. I'm going to hit the high points of it. I won't be able to get into it in great detail, but we are going to give you some resources at the end of this presentation if you'd like to read and learn more about how to solve this problem. And beware of misinterpreting fatigue for sleepiness. So this is an example of sleep restriction. Basically what it shows is we're not going to restrict a person's amount of sleep. We're going to restrict the amount of time they spend in bed. So we ask a person with insomnia basically to go to bed later and get up earlier. And in that middle section, when they're working on it, they may continue to have some middle waking, but if they persist, the middle waking gets squeezed out and pretty soon they are sleeping in a restored way again. It usually takes a few days. Let's talk now about the third cause. The brain and the body is buzzing. And so I want you to remember too that this is usually where people want to go with their strategies, but I want you to focus on number 1 and number 2, about 80% of your effort and only about 20% of your effort on this cause. Basically what's happening here is that people are spending too much time awake in bed. They have a lot of worries about sleep and they're not winding their body down. The most common one that happens is that the bed becomes associated with thinking, tossing and turning and exerting a lot of effort. And we call that the light bulb effect. And what that means is that you feel pretty tired, and as soon as you go to bed, ding, it's like a light bulb turns on and your mind starts thinking. So it's an indication that you have conditioned arousal to the bed. It just means your bed's been associated with being awake. And so we ask you to get up out of bed if you're not sleeping and go and do something more pleasant. The other thing that can happen is that people have a lot of worries about not sleeping and they feel like it's catastrophic, or that they try to get to the evening and aren't giving their body an appropriate wind down time. So let's talk about a few tips for that. One is, if you are awake in the middle of the night, give yourself a few minutes to see if you're going to fall back to sleep naturally. But if it's become a pattern for you, I'd like you to get up. This is one of the hardest things that people have to do, but tossing and turning is torture. And if your body is not going to give you any more sleep, there's no point in exerting effort. It would be fine to get up and go watch something on Netflix. If you're watching something and you start to feel really sleepy, like you're going to fall asleep on the couch, don't fall asleep on the couch, go back to bed, because we want to associate your bed with the place for you to be sleeping. We want to teach your brain, right, through repetition, that bed is for sleeping and sex. It's not for other activities like catching up on social media, watching the news, fighting with your spouse, or all kinds of other things that are activating. Bed is basically to be associated with a place for rest. I want you to remember that sleep is a natural process, and the more you get in sync with what your body needs, deep sleep will start to happen with less effort. For people that do a lot right before bed, I want to recommend that you give yourself a buffer zone. So this is at least an hour where you are not on email, tablets, backlit screens, right? Because we want to help the body settle, and that you are doing some things to wind down. I'm just going to touch on sleep and substances. This is a really important topic. I have to say there's lots of funny memes going around about wine drinking right now, and I'm enjoying them. But if you are a person that is struggling with sleep, I want you to really consider alcohol and the impact that it's having on your sleep. What this chart is showing us is that basically the blue line shows that if you use alcohol, it affects what's called sleep architecture. That means the amount of time that your brain spends in each of these stages of sleep. So a person that has a few drinks goes to stage 3 quickly, so they fall asleep more quickly, but you see in the second half of the evening, they're actually more awake than they are asleep. So we get what's called REM rebound. It just means a lot more REM than usual. And REM is very close to waking. Most people think it's our deepest sleep, but it's actually not. REM is very close to wake. So the more REM sleep we have, the more we wake up, the less refreshed we feel. And so you see in our person that's used alcohol before bed that they have a much less refreshed sleep. And of course, what we now know is that it's really going to affect your behavior the next day. You're going to be very lethargic and dialed down, and we're going to be right back into that vicious cycle. So please beware about substances if you're struggling with sleep. And know about sleep hygiene. So there's lots of things that I did not talk about in this presentation that you've probably heard before that is common sleep advice, like a cool, dark environment is one. And we call that sleep hygiene. And sleep hygiene can be quite useful. It tends to be some broader, more general advice. And for a lot of people, it helps. But for people that have legitimate insomnia, sleep hygiene usually is not enough. So most of my people that come to me with years or even decades of insomnia, they have done all the sleep hygiene strategies, but they aren't any better because sleep hygiene is usually not enough to correct insomnia. Usually you have to be addressing those 3 causes. So I think that I am sort of through my material here, and I'm interested if we've got some questions to address. I'm going to turn it over to Wendy to give me some questions.
Well, thank you so much, Karoline. Really, really valuable information, and I'm sure a lot of people will rethink some of the strategies they've had for getting to sleep, like having that drink before bed, etc. We do have lots of questions that have come in. Some of them you've addressed in the presentation, so I'm going to leave some of those, but move on to some of the ones that you haven't addressed. So I have one question here that came in ahead of time, saying, I have activities that cause 2 late nights a week. Is it better for me to get up at the same time every day, or better to get the same number of hours of sleep each night?
That's a great question. I think one of the things that question highlights for me is that our brain, it does a natural balancing act with sleep. So if you've had a bad night the night before and you didn't get as much sleep as usual, your brain actually goes to deep sleep faster. So what that means is that we don't have to be super concerned about the number of hours that we get. In the case of this person, I would suggest, if they don't have chronic insomnia, they might just want to split the difference. So if they, rather than get up at exactly the same time, they might let themselves sleep in by an hour. That's probably not going to disrupt their circadian rhythm, but that they don't have to worry too much about losing some sleep here and there because our brain will tend to adjust.
Great, great. Another one, more of an observation, love your comments on this. I've noticed my sleep patterns have been changing throughout the weeks we've been at home. Complete exhaustion initially, and now waking through the night.
Yeah, I think people have noticed a lot of changes in their sleep since they've been home. I agree that there's that sort of exhaustion period. And now waking, I would wonder in this case if the waking is related to the daytime activities changing so much. So in this case, I would think for this person, it could be about their sleep drive is now a little bit less than it used to be because the daytime activities have changed so much. So there's two ways that you could address that. One is to increase your daytime activity to a closer approximation of your regular routine, or the other is simply to decrease the amount of time you spend in bed because basically your body's telling you it doesn't need as much sleep as it used to. Either of those would be appropriate.
Excellent. What can I do to relieve or set aside my anxiety to fall asleep at night?
Mm-hmm. This is really tricky, and I think it's probably one of the most common questions that I get. So I want you to remember that bedtime, this is going to sound kind of funny, but bedtime is not for thinking. Sleep time is not think time, right? Think time is something that we do during the day. So I've included in this presentation a handout specifically for people that want to work on this concern that is about setting aside think time. And what that means is that you set an appointment with yourself during the day to think about all the strange and random things that you think about at 3 o'clock in the morning, but you do that at 4 o'clock in the afternoon in a contained way so that at night you can give yourself permission. You can say, okay, thanks brain, but I don't need to think about that right now. I already thought about it and I already wrote it down at 4 o'clock, so I can sort of put that aside. So I hope that that's a strategy that people can use. You do have to kind of do it in a disciplined way. It's not like a magic bullet. You have to practice it.
Great. Any sleep tips for kids?
Mm-hmm. I was just thinking about this right before this presentation. So kids are sort of their own animal. The strategies that we talk about for adults are slightly different than kids, but I think some of the themes are the same. One theme that is the same is maintaining routine and wake time is going to help kids get a good night's sleep. So that's an important part for kids. The other thing that's really important for kids, especially for teens, is that the bed is a place for sleeping. It's not a place to watch movies on your laptop, text your friends, do your homework, and do a lot of other activities. So protecting the bed as a place for sleep and maintaining routine are two of the most important things that we use to help kids get back on track.
Excellent. So here's one that's a little more psychological as well as sleep. So what type of long-term psychological harm do you feel this pandemic can cause? I've been hearing information about the possibility of developing PTSD because of this.
Yeah, that's a really interesting question. I think that it's going to be very difficult to predict. And I know that as a psychologist, one of the things that I'm being told is that maybe there's going to be a second pandemic and that the second pandemic is going to be mental health related. And that makes me get kind of anxious, actually, because I think about how are we going to meet all of this need. But then I remember that even though everyone experiences adversity and a lot of people are experiencing a lot of adversity right now, that doesn't mean that how people react to that is the same for each person. That's what makes these things difficult to predict. Even in a traumatic event, if everyone was to experience the same natural disaster, let's say a tornado, not 100% of people will have PTSD from that. In fact, those rates might be as low as 13% and as high as 30%. So I think a lot of that has to do with the context of people's lives, their social support, how they interpret experiences, what kinds of habits they develop while that experience is happening. So that's, for me, I think is a really difficult question to answer because I think it's very difficult for us to predict how people are going to be impacted.
Excellent. Some questions that have come in throughout the presentation here. Do you have any advice for workplaces with shift workers on how best to support healthy sleep for those working through the night?
Yeah, okay, so shift work and sleep is very complex, actually, and it's because in shift work, one of the main drivers for insomnia is coming from that first cause, the circadian rhythm or the body clock. And so what we're trying to do when we're shift working is change our body clock every few days, depending on the shift that we're working. And so it's very difficult to get our body to do that, right? To fall into line with that. So often we use a treatment in CBTI called sleep anchoring. And what we're doing there is trying to find some part of the cycle over the course of 7 days that's always consistent. So the anchor is the period of time that you're always in bed, to minimize the variability in the sleep schedule as much as possible, and also to use all the tips that we talked about today. They would definitely apply. Shift work is the only place where, and jet lag, where melatonin is sometimes indicated to help a person who has chronic problems, but I would always recommend that you talk to your doctor about that.
Excellent. Another question. Is there a way to tell how much sleep we need as an individual? I believe you've given the parameters around anywhere from 6 to 9 hours, but I cannot tell if I'm a 6 or a 9 hour person because I sleep for different amounts of time each night. Is there any way or anything we can do, an exercise or something that can tell us what is our natural one?
Well, I'm so glad somebody asked that, because this was something I didn't get to talk about that I meant to, and that is how to figure this out. So the way that I would recommend figuring out how much sleep your body produces is to keep a sleep diary. At the end of this presentation, there's going to be a number of resources. One is an app, one is a website, one is a book, and all of them have sleep diaries. And a sleep diary basically means that for usually 2 weeks is ideal. What you do is you collect how much, you keep track basically of how much time you spent sleeping each night. Even with broken sleep, if you had 2 hours here, 1 hour there, and 2 hours there, and you look at what the pattern is over the course of 2 weeks. And at the end of the 2 weeks, basically you're gonna get a sense of what your pattern is and how much sleep you're producing. And then you use that amount of sleep to determine what your sleep window is based on whether you're more of a night person or more of a morning person. So if you're curious, I would recommend using a sleep diary.
Excellent. Another question, are all naps bad for being able to sleep at night?
That's a great question. You know, I'm not going to judge people about naps. Naps are fantastic. So if you're a napper and you don't want to mess with your sleep drive at night, what you need to do is learn to compensate. Firstly, if you sleep for 2 hours in the afternoon, you are not going to need very much sleep at night, right? Your body, let's say, only produces, maybe it produces 7 or 8 hours. If you sleep for an hour or 2 in the afternoon, you might only need 5 hours at night, and that would be a good night's sleep. So that's why they usually say, hey, keep your naps shorter because it won't interfere with your sleep as much. But new parents, there are lots of situations where napping is, where napping is needed. And so what you would want to do is be a little more strategic and purposeful about how long you're napping, and then adjust your nighttime by going to bed later to compensate for that nap and not expecting yourself to fall asleep at the same time.
How long, Karoline, does it take to retrain your sleep?
Great question. So I have been using CBTI probably with my patients and clients for about the last 8 years, and I have seen the whole gamut, right to people who have not slept well for 20 years. And what I say to them is, if you can be very disciplined and very rigorous for 4 weeks, you will notice a significant difference. And so how long it takes depends on how well you follow the rules. If you follow the rules, you get your feet on the floor every morning and you don't go to bed too early and you get out of bed when you wake up, you will find things are dramatically better in 2 to 4 weeks. But if you struggle with that, it's just like sleep training a baby. If you start napping a lot, if you start going to bed early, if you start laying in bed struggling, it's just like the baby that you're sleep training. You go back to 0 and you have to start all over again.
So you don't get points for doing it a couple of weeks in a row.
No, but I find that people that most of the time by the time that people get to me, they're very determined and they really want to get this problem in hand, and they want to feel like they have less reliance on things like sleep medications. And so I've seen people dramatically turn their sleep around within 2 to 4 weeks. So that is a reasonable expectation.
Starting to run a little short. We've got so many questions here. I don't think we're going to get to all of them. I'm trying to get some different groupings of them so we're not talking the same one. But another question is, how can you change from being a light sleeper to being a deep sleeper?
Mm-hmm. So if you want to be a deep sleeper, what you really want to be doing is compressing the amount of time that you spend in bed. So that was covered on those two charts where the one person was really spread out and the other person was smaller. And in a deep sleep, our brain is diving down to deep sleep. So we have to have a strong, strong sleep drive and not spend too much time in bed. So I would recommend going to bed a little bit later, getting up a little bit earlier until you feel like your sleep is deep and you're sleeping most of the time that you're in bed, about 90% of the time. And if you're still tired, you can start to move that time in bed out, but only by about 15 minutes at a time. And if your sleep starts to break and you have middle waking, you've gone too far.
Okay, and one probably last question. We've had a couple come in that have been with combinations. So people have been having stress, anxiety through this period of time, dealing with other things like menopausal symptoms that may make them wake through the night and a busy brain. So we've got all of this perfect storm going on and now really reduce their sleep. How would you recommend they proceed?
We could do a whole webinar just on menopausal symptoms and sleep because they go together. And I am very sympathetic for a number of reasons that we don't have to get into here. I'm very sympathetic to that there are changes in the body that are happening that are creating more middle waking. And so however, CBTI has been studied with women that are perimenopausal and menopausal, and it's indicated to help improve sleep quality. The same with that stress piece. So we really want to be working on not thinking in bed, not exerting effort to sleep, and focusing on our stress in the daytime so that we can protect our bedtime as a place to sleep, not to be awake thinking and problem solving.
Excellent. One last, I hope it's a quick one. We can fit one more quick question in. A couple of questions regarding apps and using sleep functions on different devices like a Fitbit or sleep tracking. Any that you'd recommend? Are these valuable?
Yeah. So a Fitbit is a reasonable approximation of how much sleep, but not quite as good as a sleep diary. A Fitbit has in it an accelerometer. So what it's measuring is how much movement you make at night. So, and usually heart rate. So, but there's some error built in. And so I find sometimes if you're anxious about sleep, wearing a Fitbit all night actually makes people a little more anxious because they look at their sleep and go, look how much time I was awake. But you remember you're supposed to be awake. I usually recommend the sleep diary, the old paper and pencil as the best way to track your sleep. That Fitbits have some problems with accuracy, but sometimes they also make people a little bit anxious. So, so I would take the advice from your Fitbit with a grain of salt.
Excellent. Well, Karoline, thank you so much. It's been tremendous, sharing your knowledge, your expertise, your experiences, and some great advice today. So I'm hoping everybody sleeps better tonight.
I hope so too. Stay up. Go outside.
So we really thank you for that. And that wraps up our webinar for today. Just a reminder to everybody, I want to get in my little medical plug here. Although we're starting to talk about opening up businesses and moving a little more, the virus has not gone away. Still important to follow our public health measures with social distancing, hand washing, doing as much staying home as much as possible and following our public health advisory. Also a reminder, we've got our hashtag Wello community that we really want to have people share some positive images, experiences, thoughts. We're here to support each other through this. So stay healthy and safe, and we'll see you next week.